we become so interested in somebody's pain after they're gone? After the overdose, the breakdown, the alcohol poisoning, the funeral, that's when people start asking about signs, childhood, depression, family, suppliers, and help. But maybe we're asking those questions a little too late. Welcome back to the Blu Mindz Podcast. I'm Blu Baby. Today, we're talking about the connection between mental health, childhood trauma, alcohol, drugs, and addiction. We'll look at public stories like Hayden Panettiere, DMX, Demi Lovato, Amy Winehouse, Prince, Mac Miller, Matthew Perry, Michael Jackson, and others. But this isn't really an episode about celebrities. Celebrities simply give us like public examples of problems that millions of ordinary families are dealing with privately. It's about the teenager quieting that anxiety, the adult drinking every night just to stay awake, the person carrying childhood pain, and the family watching somebody they love become someone they barely even recognize. My question today is, when mental illness, trauma, and addiction collide, why do we sometimes recognize the warning signs only after someone's life falls apart? And what can we do sooner? That question is a thread for the whole episode. So before we move into individual stories, I want to ground us in how common this really is. Before we get into Hollywood, also, let's take a look at the rest of America. SAMHSA stands for the Substance Abuse and Mental Health Services Administration, which is the federal agency, and it tracks and addresses mental health, substance use, treatment, and recovery. And according to it, 2024 national data, about 19.9% of males aged 12 and older had a substance use disorder during the previous year. And that was in comparison to 13.7% of females. And among young adults that were ages 18 to 25, the rate was about 25.9%. And among teenagers ages 12 to 17, the overall rate was 7.8%. So interestingly enough, teenage girls had a higher rate than the teenage boys, about 9.2% compared with 6.5%. So the point here is really clear. This crosses gender, generations, and success levels. Now connect that to mental health. SAMHSA's newest 2025 data estimate that approximately 18.5 million American adults have both a substance use disorder and a mental illness during the same year. And that's why we can't treat these subjects as two completely separate conversations. Sometimes they're deeply connected. Those numbers give us the backdrop. Now let's move to the national picture and to one public story that shows why this issue is never as simple as it looks from the outside. Hayden Panettiere. Sometimes people, they do reach out. And I want to start with Hayden because her story reminds us that struggle can be visible, it can be public, and it's still complicated. Hayden died just recently on August 16, 2026, and she was only 36 years old. And as of this recording, her official cause of death had not been determined. Authorities reported no signs of trauma or foul play. So I'm not going to speculate that drugs or alcohol caused her death. What we can discuss, though, is what Hayden herself had already shared publicly. She had talked about alcohol addiction, depression, postpartum depression, treatment, and other personal struggles, and she also experienced domestic abuse in a previous relationship. And there's something important about her story. She did seek the help, and that really matters. Sometimes people ask for help, and families, they intervene. Treatments, they happen, and the struggle it still continues. And that tells us addiction isn't always as simple as if they really wanted to stop, they would. That is where this conversation has to go next. Why can't they just stop? This is probably the question families ask the most. If alcohol, drugs, or pills are destroying your health and relationship, then why do they keep going back? Those questions, they make sense to us. They make sense to the outside. But addiction doesn't operate on logic alone. So when you're asking yourself that question, please be mindful of that. The National Institute on Drug Abuse explains that repeated drug use can affect brain systems involved in reward, stress, decision making, and self control. Over time, powerful cravings and compulsive use can develop. That doesn't remove accountability. People, they still remain responsible for what they do now. But addiction is more complicated than somebody simply deciding that they don't care about their family. For some people, the substance starts as a recreation. For others, it starts as a coping mechanism. Alcohol, it quiets anxiety. A pill, it helps someone sleep. An opiate, it numbs the pain. Cocaine may temporarily create energy or confidence. And sometimes the person isn't really chasing a high anymore. They're trying not to feel bad. And that's a really important distinction. Now, imagine someone with severe anxiety. They discover that alcohol quiets their mind. And at first, one drink works, and then two drink works, and then three, then four. Eventually, they're drinking every single night. Their tolerance increases, their sleep gets worse, their anxiety gets worse. Now they drink partly because they feel terrible when they don't drink. So, should we treat the anxiety or the alcohol? In fact, we should treat both. When a mental health disorder and a substance use disorder occur together, they're called co-occurring disorders. SAMHSA emphasizes addressing both conditions rather than focusing on one and ignoring the other. Because if somebody has PTSD and alcohol addiction, if we only remove the alcohol, then there's the PTSD that still remains there. And if somebody has depression and opiate addiction, and we treat the opiate use, then there's the depression that's still there. So treatment has to look at the individual as a whole person. And once we understand that substances can become coping tools, the next question is, what pain are people trying to cope with? Can childhood pain follow you into adulthood? The answer is yes. The CDC uses the term adverse childhood experiences, or ACEs, to describe potentially traumatic experiences during childhood. Things such as abuse, neglect, violence in the home, substance misuse in the household, serious mental health problems within the household, even incarceration and instability. Those experiences can be associated with increased risk of later mental health problems and substance misuse. But I want to be really, really careful with this because trauma does not guarantee addiction, and somebody having an addiction does not prove that they've experienced childhood trauma. Trauma is a risk factor. It isn't destiny. So let's talk about DMX. DMX, born Earl Simmons, was very open about having a painful childhood. One story he shared has always stayed with me. And he said that when he was 14 years old, someone older that he trusts gave him what he thought was a marijuana blunt. And according to DMX, it had been laced with crack cocaine without his knowledge. So years later, he became so emotional when talking about this. And he made a really important point that the drugs were a symptom of a bigger problem. He talked about painful childhood experiences that he had tried to block out. Think about that. If you're 14 years old and you're already hurting, then introduced to a powerful drug by someone that you trust. That brings me to this question. I think every parent out there listening should hear. What if we reach the hurting child before the drug does? Because sometimes the earliest warning sign isn't substance use, sometimes it's emotional pain. There is no single behavior that predicts addiction, but serious or persistent changes deserves attention. Isolation, collapsing grades, persistent sadness, extreme anxiety, self-harm, major sleep changes, maybe someone's becoming more secretive than ever and they're frequently intoxicated, they start having risky behavior or a dramatic personality shift after trauma are all the reasons to look just a little closer. Don't automatically assume that, hey, this is just a really bad kid. Ask what is happening to that really bad kid. Listen, look, observe. And if the behavior is serious or persistent, involving a qualified professional is your best bet. You don't need to diagnose that child yourself because you do not know, you're not a medical professional. The goal is to identify the problem before the coping mechanism becomes another problem. That's the goal. So the question that always comes to mind is, are some people just simply easily influenced? I believe the answer is not necessarily. Addiction isn't an intelligence test. It isn't proof that somebody is weak. Peer influence can matter, especially when someone is young, but vulnerability is much more complicated. You know, genetics can matter, family history, mental health, the stress, the trauma, your environment, the age of first exposure, the availability to the substances, relationships, all of those factors can affect risk. And that's why people can use the same substance and have completely different outcomes. And it's also why families with strong history of addiction should talk about it. You're not going to talk about it to frighten your children, but you want to educate them. There's a difference between saying, don't do drugs and saying, there has been addiction in our family. I want you to understand that this may increase your vulnerability. So the choices you make around substances matter. See the difference? Knowledge can be protective. So far, we talked about vulnerability and early pain. Now we need to talk about what happens after someone has already tried to get help and why relapse can be so dangerous. Getting help doesn't always mean a straight road. Demi Lovato gave us another side of this conversation. Demi has publicly discussed addiction and mental health struggles for years. In 2018, Demi survived a near-fatal overdose and later described serious medical conditions from it. Demi had received treatment before. There had been periods of sobriety, then relapse, then more treatment. And that's important because families sometimes say, didn't they go to rehab already? As if the treatment is supposed to be a one-time reset button. But for some people, it's not. For some people, recovery is long-term. Treatment may have to change. A different therapist may be necessary. Medication may be appropriate, or that medication may not work the same way it used to. A higher level of care may be needed. The person's environment may have changed. Underlying trauma and mental health conditions may need more attention. Relapse is really serious. It can be deadly, but relapse doesn't automatically mean somebody never wanted to recover. It's just, that doesn't make sense. And shame isn't a treatment plan. I wanted to bring Amy Winehouse in this episode because alcohol needs its own conversation. Alcohol is legal. It's socially accepted. We serve it at weddings, birthdays, restaurants, vacation. We drink when we're celebrating. I mean, there's a liquor store on every corner, it seems, within miles away. It's easily accessible. We drink when we're stressed. We drink when we're grieving. And because alcohol is so normalized, sometimes we don't recognize how serious alcohol use disorders can become. Amy Winehouse died in 2011 at only 27 years old. A second inquest confirmed that she died from alcohol poisoning after drinking following a period of abstinence. Her story reminds us legal doesn't mean harmless, and there's another important medical point here. Someone who is physically dependent on alcohol may need medical guidance to stop safely because severe alcohol withdrawal can become dangerous. So, if somebody's drinking heavily every day, just pour everything down the sink tonight might not be the safe advice. Sometimes the first step needs to be a medical assessment. Prince and Mac Miller illustrate another different type of danger: counterfeit pills and fentanyl. Allegedly, Prince died from an accidental fentanyl overdose in 2016. So investigators concluded that he apparently believed he was taking Vicodin, but counterfeit pills contained fentanyl. Authorities could not determine who supplied those pills, so no criminal charges were filed in connection with his death. But Mac Miller, on the other hand, he died at 26. The Los Angeles County Medical Examiner determined that his death resulted from mixed drug toxicity involving fentanyl, cocaine, and alcohol. His death was ruled accidental. Federal prosecutors later brought cases involving counterfeit oxycodone pills containing fentanyl that had been supplied in connection with Miller's death. These stories make one thing very clear. A person may think they know what's inside a pill, but in fact, you may not know. And a counterfeit pills can look like legitimate prescription medication while containing fentanyl and other unexpected substances. SAMHSA continues to warn that fake pills can contain fentanyl and it can be deadly. That risk brings us to another hard part of this conversation. When a vulnerable person is not only struggling, but also being supplied, enabled, or exploited by other people around them. The question that some of you may ask is, can vulnerable people be exploited? And that answer is yes. Matthew Perry's case is one of the strongest examples of that. Perry had publicly discussed addiction and recovery for years. He died in October of 2023 from the acute effects of ketamine, with other contributing factors. The federal investigation eventually resulted in prosecution involving 5 defendants, and that was including the physicians, a drug dealer, and his personal assistants. In May 2026, Perry's living assistant became the 5th and final defendant sentenced in connection with his case. The Justice Department said the assistant had repeatedly obtained and injected Perry with ketamine, including the fatal dose. And this is where the conversation becomes bigger than, well, he was an adult. He made his own choice. Adults are responsible for their choices. Yes, you're right. But that does not give somebody else permission to illegally supply, dangerously administer, or profit from a vulnerable person's addiction. Both things can be true. A person can have responsibility for their own behavior. Yes, we know this is true, but someone else can still be exploiting them. So, which brings us to our next question. Should people who supply the drugs be arrested? If somebody illegally distributes controlled substances, they can already be prosecuted. And when drug distribution results in death under the applicable law and the evidence support it, penalties can be extremely serious. But we still need the evidence. Investigators still have to prove who supplied the substance, what it was, whether it was legal or not, what the supplier actually knew, and whether it legally caused the death. Mac Miller's case shows suppliers can be prosecuted. Matthew Perry's cases show doctors, dealers, and assistants can face those consequences. And Prince's case shows why suspicion alone is not enough. Accountability matters, so does evidence. Michael Jackson. Sometimes the person who loves you says no. I'm going to keep Michael Jackson brief because his circumstances were a bit different. Jackson died from acute propofol intoxication, and his death was ruled a homicide. His physician, Dr. Conrad Murray, was later convicted of involuntary manslaughter. And propofol is a powerful anesthetic, and Jackson had been receiving it in his home while struggling with severe insomnia. And that case raises a different question. What happens? And this is just a question that I'm thinking of. What happens when money, fame, or power make it easier to find somebody willing to keep saying yes? Sometimes protecting somebody means telling them no. No more access to what can kill you. No, I won't help you continue something that can kill you. Sometimes no is an act to love. Support is not the same as enabling. This is especially important for families supporting somebody that might sound like this. I'll help you find treatment, make the call, go to the appointment, or sit with you and your family counseling. Enabling may mean constantly lying for somebody, financing the substance use, covering every consequence, or making it easier for the addiction to continue. But I don't want to shame families, The families, you need help too. That is the boundary piece. Now, I want to turn this into something a little more practical. What can listeners actually do before things become a crisis? If you see the signs, step in. This is the part of the episode that I really want people to remember. Don't just finish this episode knowing more about addiction, but know what to do for your loved ones or somebody that you know, family and friends. If somebody's behavior has changed and you're concerned about that, you do not need absolute proof of addiction before having that conversation. Choose a calm time. If possible, don't try to have the serious conversation while the person is intoxicated. Start with what you've actually observed, right? So instead of saying, you're an alcoholic, try this. I've noticed you're drinking every night and you miss several times at work. I'm really worried about you. Instead of, what's wrong with you? Try, hey, what's been going on with you lately? Ask, are you using something because you're trying to cope with something? Or what happens when you try to stop? Or would you let me help you talk to somebody? And then actually listen when you're asking those questions. Just show them that you're concerned and you're not making them feel bad or shaming them. You're actually there to help and you have a genuine concern about them. SAMHSA's Family Guidance emphasizes concern, communication, avoiding shame, and encouraging treatment. And if the person doesn't accept help after one conversation, that doesn't necessarily mean the conversation was pointless, because indeed it wasn't. Then offer something concrete, not you need help. Try, let's call someone together. Or I'll help you find a treatment provider. Or I'll go to the appointment with you if you want me there. That's actually called stepping in. And don't wait for them to hit rock bottom. I want to challenge this idea that some of us have. The person has to reach rock bottom before they're ready to help. Tell me why. Why should somebody have to lose their job, their marriage, their children, their health, or nearly die before we decide that it's time to intervene? There's actually a healthcare approach called SBIRT, screening, brief intervention, and referral to treatment. It's designed to identify risky substance use earlier, intervene, and refer people for more intensive treatment when necessary. That tells us something important. Early intervention is a legitimate treatment strategy. We don't have to wait for a disaster. A doctor can screen you. A behavioral health professional can screen you. A pediatrician can ask about substance use. A qualified addiction professional can determine whether somebody needs education or if they need outpatient care, medication is needed, intensive treatment, or any other level of support. You don't need to diagnose yourself first. We need to notice also what are the warning signs in adults. Again, one behavior doesn't prove someone has an addiction. So we need to look for patterns like needing more to get the same effect, right? So that's when you'll hear the person that has the addiction asking for more and more and more and more. Repeated failed attempts to stop. Every time that this person tries, they fail because the drug or the depression or whatever it is the root cause is still there. Hiding use, withdrawal, blackouts, neglecting responsibilities. Maybe they're not taking care of their children like they used to. They're not paying the bills like they should, relationship or financial problems, misusing medications, or continuing despite clear consequences. Those deserve attention too. Now, I know some of you are asking, like, what if they refuse the help? This is one of the hardest realities for families. You cannot personally control another adult's recovery, but there is a big difference between I can't control this and there's nothing I can do. You can speak with an addiction professional yourself. You can learn how to establish boundaries. You can stop financing substance use. You can stop lying to employers and relatives to hide what's happening. You can protect children in the household. You can learn overdose skills and you can take care of your own mental health. SAMHSA describes an evidence based family approach called CRAFT, CRAFT, Community Reinforcement and Family Training. CRAFT teaches family members strategies for encouraging healthier behavior and treatment engagement without relying primarily on confrontation and shame. Family members can also seek counseling and peer support for themselves because we need the support too. This is not an easy situation. You don't have to wait for the person using substance to agree to treatment before you ask for guidance. That may be the first step that changes the whole entire family's direction. Now, once we know how to step in, the next question is where can people turn? And what real treatment and recovery can actually look like. Now, when is the best time to get help? I would say that earlier is better. If you're wondering whether you're drinking pills or drug use is becoming a problem, or if you're using substance to escape emotional pain, that's worth talking about right now, ASAP. You do not have to wait until you're nearly dying to qualify for help. It's never too late. Some of us think that it's too late. It's never too late. As long as someone is alive, treatment still matters. Even if there are consequences, damaged relationships, legal problems, or medical issues. And recovery is not pointless just because life has already been complicated for you. People recover after years and sometimes decades of substance use. So recovery may include medical withdrawal support, therapy, trauma care, family counseling, peer support, medication, or a different level of treatment over time. There is no single recovery path that works for everyone. I also want to clear up a misconception. Sometimes people hear about medication for addiction and say, you're just replacing one drug with another. That isn't an accurate description of evidence-based treatment. There are approved medications for opiate use disorders. There are also medications used in the treatment of alcohol use disorder. Those decisions belong between patients and qualified clinicians. But listeners should understand that addiction treatment isn't simply go to rehab and use more willpower. No, this is healthcare. Now, here's the hard part. Telling people to get help only works if help is actually reachable. According to SAMHSA's 2025 National Survey on Drug Use and Health, among people aged 12 and older who were classified as needing substance use treatment, only 16%, about 1 in 6, received substance use treatment that year. Among young adults 18 to 25 who needed treatment, only 9.6% received it. And HRSA, which stands for the Health Resources and Services Administration, they continue to track communities designated as mental health professional shortage areas because access to behavioral health professionals remain uneven across the country. So HRSA's shortage area data is updated regularly. So yes, people need to reach out, but we also need systems with enough professionals, programs, affordable care, insurance coverage, and services for people with both mental health and substance use disorders. Now, where can we start? Where can people start? Here are real starting points. SAMHSA's national helpline is 1-800-662-HELP. And that's 1-800-662-4357. That's free, confidential, and it's available 24/7 for treatment information and referrals. And you can also find that information on findtreatment.gov, SAMHSA's confidential treatment locator. If money, this is important now, if money or insurance is a problem, HRSA supported community health centers may be another resource, another place to start. HRSA funds about 1,400 health centers operating more than 16,000 service sites, and health centers provide services on sliding fee scales based on ability to pay. Also look for a certified community behavioral health clinic, or they call it CCBHC. These clinics provide coordinated mental health and substance use services and are required to serve people requesting care regardless of ability to pay, age, or place of residence. They also provide crisis services. When you contact a treatment provider, I would like for you to ask this question. Do you treat co-occurring mental health and substance use disorders? That question is really important, so make sure you ask that. Again, the question is, do you treat co-occurring mental health and substance use disorders? Let's talk about a crisis. If there is an immediate crisis, let's just say if your loved ones is unresponsive and an opiate overdose is possible, call 911 and use Narcan. Those are things that family can learn before an emergency happens. If you want to learn more about Narcan, reach out to your medical professional. That's something that you can have on hand in case there's an opiate overdose. Again, it's called Narcan. And now I want to talk about hope, because I refuse to end this episode with tragedy, because addiction does not always win, right? So Robert Downey Jr. spent years struggling with drugs and alcohol. There were arrests, legal problems. He was incarcerated, treatment. He'd had treatment. At one point, it would have been very easy to look at his life and say, oh my God, he's so finished. But today he has been sober since 2003, and he has rebuilt both his life and his career. Demi Lovato, she survived an overdose and continued pursuing recovery, reminding us that relapse does not have to be the end of the story. And then there's an even bigger number I want people to hear. According to SAMHSA's 2025 national survey, among adults who said they had ever had a problem with alcohol and drugs, listen to this, 73%, 22.3 million people said they considered themselves recovered or in recovery. 22.3 million people. We talk so much about the people addiction takes that sometimes we forget about the people who recover. Recovery isn't just a celebrity comeback story. Millions of people, they're actually living it. Now, that brings me to my final thoughts, that I want to leave you with before this episode ends. When I think about every story in this episode, which is super sad to me, I keep coming back to one thought. After somebody dies, you investigate everything: their childhood, relationships, mental health, the drug use, the doctors, the friends, and their final days. Suddenly, everybody wants to understand their pain. But what if we became that interested while people were still alive, while they're still living? When the child's behavior has changed, when that teenager got so quiet, and when that adult said that I'm not okay. What if we treated trauma earlier, screened for risky substance use sooner, help families step in without shame, and stop waiting for rock bottom? And what if instead of saying, why can't you just stop? Why don't we start asking, what's happening to you? And how can I help you get the right treatment? That doesn't mean ignoring accountability. Compassion and accountability can exist simultaneously. You can say, I love you. And you can also say, I won't help you continue this. You can say, what you're doing is hurting this family. And you can also say, I will help you find treatment. And to the families that's out there listening, learn now. Talk now. Ask questions now. Get professional guidance now. And if they refuse treatment, get help for yourself too. To the person struggling, you do not, and I repeat, you do not have to lose your entire family. Your job, your health, or your life before you ask for help. You can start with 3 words: I need help. That doesn't make you weak. It may be the decision that keeps you here. So if there's one thing that I want Blue Crew to take away from this episode, it's this: notice it, ask about it, step in, connect to help them, and don't wait for rock bottom, because someone struggling with addiction is still a person, not an addiction, not a diagnosis, not a headline, not a tragedy waiting to happen. And while they're still here, there was still an opportunity to reach out to them. This is Blu Mindz Podcast, and I'm Blu Baby. And from my heart to yours, take care of your mind. Pay attention to the people that you love. And don't be afraid to ask somebody, are you really, really okay? And then stay there long enough to hear the answer.